Hey guys, welcome to the Endocrine System lesson of the online EMT course. In this class we're going to cover a topic that in my opinion may well be the least understood body system that you'll learn about. That's unfortunate because many of the medical issues we see on a daily basis are directly related to endocrine function. Let's start with an anatomy lesson. There are two kinds of glands in the body: exocrine glands and endocrine glands. Let's discuss the difference. Exocrine glands manufacture and secrete some substance into a duct so it can reach another area. For example, salivary glands secrete saliva and it travels to the mouth. Lacrimal glands secrete tears. Mammary glands secrete milk, etc. Endocrine glands are different. They are said to be ductless. That means that the substances they make directly enter the blood vessels that pass through the gland and are then transported by the circulatory system. Something like this illustration I'm drawing. This is kind of neat because those substances then have the ability to reach every cell in the body. These substances manufactured by endocrine glands are called hormones. Hormones are very strong chemicals that help us to regulate some body function. For example, there are hormones that help us regulate the amount of sugar in our blood. Hormones may affect one or two organs, or they may affect every cell in the body. It all depends if the organ or cell is sensitive to the chemical properties of that hormone. You'll see some examples a little bit later. Hormones may influence both physical and psychological health. Ever hear of menopause? Ever meet a lady going through it? Finally, when we think of medical conditions, problems can be caused by both too little or too much hormone production. For example, there are two thyroid-related problems: hyperthyroidism, too much thyroid hormone, and hypothyroidism, too little. Now, there are actually many hormone-producing structures in the body, but we're only going to focus on about 8 of them today. Here we go. The first is the pineal gland located up here in the skull. It makes melatonin, which you may have heard about. Melatonin affects sleep cycles and additionally has some influence on reproductive systems. Another gland found in the brain is the pituitary gland. The pituitary has a nickname. It's called the master gland because it affects every other gland and every cell in the body. One of its primary jobs is to make growth hormone, which dramatically affects cellular metabolism. Next on our tour is the thyroid gland. Thyroid hormones are extremely important in regulating growth and metabolism. The thyroid and the pituitary work very closely together. Within the thyroid is special tissue that makes up different glands called the parathyroid glands. Its hormone is extremely important in bone health. Just south of that is the thymus. It's located in the upper chest and stimulates development of our immune system, which helps us to fight off infections. The thymus is most active early in life when kids are developing immunity to the germs they're coming into contact with. Next are the adrenal glands, which live on top of the kidneys. The adrenals are super important, and I'm going to talk about their hormones later in this lesson. Not far away is the pancreas. Now, the pancreas itself is not an endocrine gland, but within the pancreas are structures called the islets of Langerhans. They're named for a German scientist who first identified them. They make insulin and glucagon, which helps to regulate blood glucose levels. Finally, we have the gonads. This is the term used to refer to the primary male and female sex organs. In males, this would be the testes. In females, it would be the ovaries. The testes produce testosterone, which drives male sexual development and makes men act like men. The ovaries, like women, are more complicated. They secrete both estrogen and progesterone, which drives female sexual development and maintains the organs associated with pregnancy when it occurs. Now we need to talk a little more about those hormones made by the adrenal glands. But before we do, let's talk about the sympathetic effects. These are related to the autonomic nervous system, which is covered in more depth in the nervous system lesson. Now, the sympathetic effects are related to the fight or flight syndrome. This describes how our bodies respond to stresses, either externally, like something trying to hurt us, or internally, like a disease or an injury. When activated, the sympathetic nervous system has the effects shown here on this slide. These effects occur due to activation of one or more of the receptors listed here. When alpha-1 receptors are activated, blood vessels constrict. That means they get smaller. This increases the pressure in the vessels. The effects of stimulating alpha-2 receptors is not that important to us. Basically, they work in conjunction with alpha-1 and moderate those effects. Beta-1 receptors are found in the heart. When activated, they increase the rate and strength of the heart's contractions. Beta-2 receptors are found in smooth muscle throughout the body. We are especially concerned with the smooth muscle in the large blood vessels and in the bronchioles. When activated, we see dilation of blood vessels and the airways. This permits more blood flow and airflow into the lungs. Okay, I know that's a lot of complicated stuff and you're asking, what's this mean to me? Well, it has to do with those adrenal hormones. So let's look at them. The first is epinephrine. You might know it by its other name, adrenaline. When the body is stressed by some threat, a very big, very mean growling dog, or a serious traumatic injury, your adrenal glands pump out the epinephrine. Epi, as we healthcare pros call it, activates all four of those receptors, so we see the effects previously mentioned. An increase in blood pressure, an increase in heart rate, dilation of the airways and increased respiration. All of these things happen to rev our bodies up to fight the threat or to run away from that big dog. The other hormone made by the adrenal glands is norepinephrine. It works almost exclusively on alpha receptors, so its primary effect is to jack up your blood pressure. Now, these are naturally occurring body responses. So what can we learn from that? Well, first, we expect our seriously ill patients to show sympathetic effects like tachycardia. That's actually a clue that a patient is under significant stress from their medical problem. The other cool thing is that we can use this knowledge to treat our patients. Later in class, you're going to learn about medications. As an EMT, you can assist with administration of a drug called albuterol. Well, albuterol is a beta-2 agent. That means its primary effect is to stimulate beta-2 receptors, which cause the airways to open. What kind of patient do you think might get that med? If you said asthma, you would be correct. This knowledge is also useful even if you're not giving the medication yourself. If someone told you that a patient was receiving an alpha med, what do you think their problem is? If you said low blood pressure, you would be right. All right. Hopefully now you better understand how the endocrine system helps us to control body functions. You'll learn more about endocrine issues later in the medical emergency section. Well, that's it for this lesson. Catch you later.